Welcome to my YouTube channel. It's Bonnie Southgate, hEDS Rehab here, specializing in everything for people who are hypermobile. So this is part of my series looking at your Pilates exercises. If you take Pilates classes, then I'm going to take you through all the basics and all the pitfalls for somebody with hypermobility, or all the things that might help. And I'm also doing this, so if you don't take a Pilates class, then you can start from my video number 1 and you can work your way through and you can build yourself up watching these videos through your Pilates. So I'm taking us into one of the most basic, simple exercises that you will find almost every single Pilates teacher starts with, and that is the simple knee float. And the basis behind the knee float was Pilates exercises. A lot of the legs were in the air, and we wanted to learn how to get those legs in the air nice and safely without compromising anything else. So there's two different camps in Pilates. There is the classical and there is the contemporary camp. I don't favor one over the other. Some of the classical does some fantastic stuff, and I think Pilates knew what he was doing and he had a lot of the positioning right, but the contemporary people also make more allowances for people with issues, and maybe they cater to people who need to be catered to a little bit more specifically. So both are really great. I haven't got a problem if you want to take either type of class, but what I will do is again give you some of the basics behind some of it, why Pilates might have done it in the classical versions and why they might be altering it now. So with the knee float, this is not just about learning how to bring the legs in the air, but it's learning how to move in the hip joint without moving anything else. So it had become a bit of a stability exercise for the pelvis. I'm not as fussed about that, and I'm not as fussed about the neutral pelvis. I think that it's about moving the body and getting everything moving as well as it can be. But I'm going to take you through what you might want to think about and ways to begin your basic knee floats. So whether or not you're in your neutral pelvic position, I want you not to worry about it too much. We have different placements for the feet. So if you place your feet closer to your bottom, you have more fold at the knee. And you may find, if you are hypermobile, that might help you relax your hips. If your feet are further away, you can have a little bit more potential to fall into that posterior tilt, but neither is wrong. Now, the only thing I would say is the further your feet are away from you, the longer the lever is that you're lifting, so the harder the effort will be, because the center of gravity will be further away from you. So let's start with the legs closer in. If you have knee issues, be a bit careful of that. But the further in you bring those heels towards your sit bone, the easier it will be to lift the leg. Now, some people think this is all about the abdominals. Realistically, if you let go of the hips, it doesn't really need abdominals to work just to fold the leg in the air. When we bring the second leg up, then you might need to think about it. But it's a basic movement of the hip joint. And what you need to make sure that you can do is relax the front of those thighs in order to allow that hip bone just to translate into the socket. You also need not to grip your bottom, because if you do, you don't let the hip joint move. And in this position, the only thing I'm actually moving is my hip joint. So traditionally, a knee float is taught. So once the leg comes into its correct position, I don't know if you can see me here with the fireplace, it's not that easy. My knee and my hip bone are in a straight line up and down, and my shin would be in a straight line to the ceiling. So we would be having a straight line and a complete right angle at the knee. Now, for somebody starting out with hypermobility who might be a bit grippy in the hip and might want to use their quads rather than letting this go, they might tend to have their foot a little bit higher. So I do tend to ask my clients to start by dropping their heel right down. So they've got a big fold, and the fold then is just, or the effort is just about learning how to fold the hip without tension. So nothing should be grippy. And then as you get better at that and you know you can relax that hip, then you might start to bring that foot up more into what we call the tabletop position. So you can practice on both legs. You might find one side is harder than the other. Just let that heel come towards your bottom to lift that leg in the air. If you've done your Pilates class and you found your knee float is painful, then start by trying to just drag that heel to your bottom and fold the hip rather than bringing it up here. The less you grip around the hips, the less painful it will be. And what I want you to really be aware of is that when you go to just fold that hip, is that you're not locking everything down in the abdominals and gripping. You'll find you really don't need to do that just to bring one leg in the air. So that's your very basics for lifting one leg into a knee float. We'll progress to two legs a bit later, and we'll look at how we do recruit the abdominals when we're going to take more than one leg and we're going to start to load things. So that is your basics for starting your knee floats in Pilates. I hope you found that useful. Have a go, try it out yourself. If you feel that you're struggling to let the tension go on the side of the hips, you can take your fingers or your thumbs and you can gently pull the tissue sideways, and that might help open up that hip for you. Let me know how you get on. Subscribe if you aren't subscribing. There's lots of videos for you to look at on my YouTube channel. Take care and have a great day.